one of the ones that I found fascinating was the one dealing with coping with loss and with grief. The floor is yours. I'll give you a few moments. We have psychologist and hypnotherapist Krisnan Hurdle joining us. Hi, Krisnan. Nice to have you
Hi,
with
good
us
morning,
today.
Peter.
I know that you've been doing a series, and this is again taking advantage of a captive audience who are not able to go out, and so they're making proper use of their time. And you had a series for the first part, a 15-day series on mental wellness. And one of the ones that I found fascinating was the one dealing with coping with loss and with grief. The floor is yours. I'll give you a few moments, not as long as you took with that, but to break it down for us and for our viewers.
All right, thank you very much. In our series, 15 Days of Mental Health, we looked each day at a different aspect of how persons can cope during this period of isolation. It can be used for the initial 15 days, which was done, as it could be extended towards these towards the remainder of the month and the remainder of the pandemic and any other pending national pauses that we may experience. So I shared coping strategies. We did activities including exercises, literally physical exercises that persons can engage with and engage in while they're inside. We also had a frontline medical doctor who shared her experiences of how she coped with anxiety, having to work with patients in isolation facilities during the pandemic. And we also we just shared different tips on mental health issues, anxiety. We looked at a little bit at loneliness. We looked at depression and grief and loss.
All
And
right.
interestingly, today is the anniversary of my mum's passing.
Oh,
And so it is a, a meeting of, I think it is a time where I get to reflect and reflect also on how the strategies that I would have learned before that event occurred to help me to cope with it. And now I'm able to share tips and strategies and work with clients as a clinical psychologist and hypnotherapist to help persons to get over their time of loss and grief, and just to cope in this time
yeah.
of national pause.
Why is physical exercise so important when it comes to coping with stress or with grief or with loss?
Well, not only does it allow the individual to get out and literally express themselves, extend their muscles and physically, but it also allows the individual to, as you mentioned just now, as opposed to being indoors and feeling like the walls are closing in and everything is closing in, it allows, even if it is indoors, allows the person to kind of extend their mind, extend their body beyond the present circumstance. But with exercise, natural endorphins, hormones, feel good hormones, are distributed and produced in the body so that one usually feels, sometimes it could be a little bit of a high, or they just feel a little better, they feel a little happier, they feel a little more lively and vibrant. And so along with these endorphins, adrenaline is produced, and that helps us to cope a lot better when, as opposed to mourning and isolation, there's a feeling of closing in. You get to do that kind of expanding of body and mind while we exercise.
Mm-hmm.